Hi, Jen.
Hi, Bethany.
I am so happy to be in here with you right now. We haven't been recording for almost 2 weeks.
I know, we're back.
Even though it's rainy outside, I woke up so happy this morning.
Me too.
You're good. I was hoping you'd say that. We have a couple shout outs because while we were gone, some little humans have been brought into the world. The first shout out is to my cousin, Christine, who welcomed her little boy, Mason, via C-section, March 11th.
Yay.
And they're all happy. And she said how much our episodes, because she didn't know she was going to have a C-section.
Oh, she didn't. Okay.
And I gave them their birth class. And then I said, really for the C-section aspect of it, listen to some of our episodes. And she said one of the things that was the most helpful for her was the OR smell. She was like, I had already been through labor for 2 days. And that was something that I was so glad it would have thrown me off so badly.
Yeah.
Had I not listened to the episode.
Just one less thing.
One less thing to be concerned about.
Yeah, wonder what's going on.
Yeah.
Amazing. Congratulations.
Yes,
Welcome,
congratulations.
Mason.
Yes.
And then also we received a baby photo from one of our listeners.
Yeah.
And that's happened a few times now. And it's so nice because you've been listening throughout your pregnancy. And then when the baby arrives to get a message from you. So shout out to Brittany.
Yes.
And congratulations.
Congratulations.
On your new bundle of joy. Yeah. We're so happy for you. And it really just, it's what this is all about. We love hearing from you and especially seeing you through. She said that she was able to advocate for herself and get a lot of the things that she was hoping for. So congratulations.
Yay.
And today we are recording our 30th episode, which we are the big,
Five.
you know how we're numbers people.
Yeah.
So it's a nice round number and it's a big accomplishment. So very proud of us.
I'm proud of us too.
And today we're going to talk about something that is also a long awaited, I think, episode.
Yeah.
We've been saying we have to do a deep dive on anxiety.
Yeah.
Because it has always threaded its way through a lot of our conversations, this topic.
Yeah.
And we are going to spend a whole, however long it takes, we never know, we'll see, discussing anxiety and sort of validating it and discussing options for management, treatment.
Get those tools in your tool belt to help you.
My-
Because can I tell you the first thing when I looked up anxiety, I always find it funny when I put in like anxiety, what does AI come up with? It's like this like.
Oh, you're starting to use it more.
Oh, yeah. Yeah. I'm in 2025 now, Jen.
Welcome.
I'm out of the 50s.
Yes.
And so I thought that was so interesting. The first sentence is anxiety, a normal human experience.
Yeah.
And I thought, you know what? It is a normal experience. We're all going to experience it. There's so many different variations of anxiety.
Right.
But again, it goes back to like when we talked about crying. This is normal. And I think if we start normalizing some of these feelings, that in itself might help you feel less anxious.
Like if I had $1 for every time a patient said, I'm just feeling very nervous.
Oh, I
I'm
bet.
very anxious right now.
Jen would be retiring.
I'm like, don't worry, I got it. I've done this before.
Yeah.
And I've heard that before and it's so normal. You're right. I mean, everyone experiences it a little bit differently.
Yeah.
There's the normal skited word, the scared, excited.
I love that word.
Yeah. And then there's people with real panic disorders and things that might require pharmacologic treatment. So we should discuss all of it. And you have to kind of know where you fall, I guess.
Yeah.
And people do know. A story that I wanted to bring up, and I wasn't going to bring it up this soon, but I always talk to patients because it is such a common thing for people to say. I'm always like, don't worry, I got you. We're going to talk you through this. Sometimes people request medications. A friend of mine has asked me this too, like, what should I do if I feel like I might need a medication? Sometimes people will request that, or they're kind of hinted it, like, can I get a medication? How do you feel about it?
Yeah.
And I always recommend to ask your anesthesiologist to have a medication ready for you because it might not be a medication that they keep so close on hand. To know that you can get it at any moment.
Well, that in itself calms you.
That often does it for people. You just know that if you're not coping anymore, if every other strategy that you have brought in that your medical team is using has not quite done it, that you know that they work so quickly. These medications are not going to take a long time to work. So it's sort of like, get ready for it. And if you need to pull that trigger, then you can go ahead and do it. But I had a patient once who was so calm. She was so chill and, you know, just we're talking and she was like, I have anxiety and I've had panic attacks before. And I was like, don't worry, I'll talk you through it. Having the conversation with her, I thought she was going to be fine. I really did.
Yeah.
But I told her the same thing that I tell most patients who are very concerned about anxiety. And I said, I'll have the medication ready. And what do you know? She got her spinal and she had a full blown panic attack. And it was, I'm going to discuss why anxiety is important to recognize and why it is important that we do everything that we can to mitigate it.
Yeah.
But I mean, she was trying to get off the table and she could injure herself. Right. So thank goodness I had that medication. And in seconds, as soon as I could get it into her IV, she was like transformed back into being fine.
But how important too it was that she let you know ahead of time, because you wouldn't have been able to react that quickly had she not prepared you.
I was so glad because I was so ready to just treat her, and I knew I could see that it was a serious reaction, I guess.
Right.
Like she was truly panicking, and I was able to get her through the surgery. She was just kind of snapped back to normal. One of the things that we will discuss is the effects of the medications. And I just in thinking about it, it's sort of like when we talk about pain and how if someone gets a pain medication and they're not really in that much pain, how they have all the side effects from it. They're drowsy, all these things. But when someone is truly in pain, it just takes away the pain.
Right.
And I think anxiety is the same way. If you really need something, it just brings you back to baseline. It's not going to really overly sedate you. Depends obviously the dosage and exactly what they're giving you. But for the most part, if you're managing it properly with medications, it's just bringing you back down to where you need to be. It's not really doing a whole lot more than that. Where should we start the conversation?
Well, I just wanted to say this before we get moving. I'm sure too, but you probably don't recognize about yourself is the tone in which you talk to patients and the calmness in which you tell them, like, I got you.
Yeah.
I have this under control. We have medication that can help you. And how much the nervous system responds to somebody's tone of voice and how they're being talked to when they're feeling themselves get out of control.
Yeah. Well,
how important that is.
That's what I told her. I was like, well, you haven't had me as an anesthesiologist. Right. You're going to be fine.
Yeah.
But no, you know
but
what?
You should take that moment to recognize how helpful that is for you as a doctor, for your patients to come across in that calm, centering voice,
right,
to help them feel safe and secure.
And it is so common, but it is very important to know, and especially if you know how severe what your previous experience has been with anxiety. Have you had to be treated for anxiety in the past, or is this just kind of like a nervousness going into it? And I mean, obviously you're coming and you're having a baby and you're having surgery.
Right. Who isn't feeling anxious,
which again,
and nervous.
We're combining two things.
Right.
Preoperative anxiety in general is common.
Do you ask your patients anything about anxiety, or do you kind of wait for them to bring it up to you?
No, I don't. I just, people tend to bring it up.
Yeah. Well, I figured that, but I don't know. Like,
and actually, so that's not entirely true. If I can see that they're nervous, then I will bring it up.
Okay.
Yeah. I won't just bring it up out of the blue, but I can usually
You're not
tell.
like trying to create something that isn't there yet.
Yeah. And sometimes you see like the sense of relief. They're like, yes.
Yes. You're acknowledging my feelings. Thank you.
Nervous. And so, if I can see it, obviously, then yes, I take that opportunity to discuss it further, because maybe they were thinking like, will there be medications? What can I do if they haven't brought in their own tools for managing it?
Right.
If I see that, then I'll open up the discussion so we can talk about it a little bit more. And also in general, as far as preoperative anxiety, so just anyone coming in for surgery, we pretty much give something for anxiety to almost everyone who's having surgery, unless they're really elderly. Yeah. Just because then the more medications you give, you have risk for delirium and such post-operatively. So we might withhold it in those scenarios just because risk benefit wise, you want to limit the amount of medications you're giving to someone. But overall, like we pretty much give it to everybody who's having surgery.
Except for in a C-section.
Except for in a C-section.
Right.
Yes.
Another head shake, but I don't know.
Right. No, and then the other statistic, so we treat it almost universally for any other surgery. But then if you look at how likely they are to have anxiety with a C-section, you're much more likely,
Right.
even more likely. In both cases, it's common, but even more likely when you're having a C-section than going in for any other surgery as well. So it's like double whammy, but without the medication. So if you're feeling like you're so anxious, it's hard because you're getting less treatment and you're more likely to suffer with this. So
let's first talk, if you know you're going to have a planned C-section, how that kind of unfolds, and then just anxiety around birth. I think
that's like kind of
pretty common.
Related.
Even anxiety during pregnancy is, I think, a normal finding with a lot of women.
Well, that's why they even say, because I was obviously looking up research articles, but I just love seeing it in black and white when they're like, this is very common.
Yeah.
And it's more common in a C-section because you have the surgery anxiety plus the childbirth anxiety.
Right.
If you're not having a C-section, then you may have childbirth related, anxiety or pregnancy related, all of that. But then combine it with something that you're having a surgery, it's just additive. So
did you have anxiety?
I do.
I know. Okay, but did you have
generalized anxiety? But no, I wasn't that bad. I wasn't that bad. There was moments during the surgery, like I've talked about before, when I was sitting up for the spinal that I was like, whoa, hit me. And then also, I did the version before, and I heard the baby's heart rate go down, and then we were like, maybe
your anxiety went up a lot.
So then it was kind of like an up and down thing.
Actually, with you saying that point, an up and down thing, I think that's also a very normal finding. It's like you might have moments where you're like, I feel okay, I feel calm, and then something shifts very quickly, and then all of a sudden you're not prepared for whatever that shift is, and then your anxiety starts to build, and then maybe the medical team takes back control and they give you that confidence that like everything's now okay again. Like we've talked a lot about when the heart rate is having any type of like decelerations, like
the baby.
Of course, the medical team, if everything comes back up and you're like, okay, you're okay. Yeah. But the patient isn't immediately like, oh, okay.
Coming down.
All is okay again. Right. No, that anxiety is still
especially
there.
when if you don't know that this could happen. It's just a lot of new experiences, and it's such an important day for you, obviously. Yeah. So these statistics are all just depressing, but
well, good thing I got some uplifting news after.
Okay, good.
Jeez.
But this is more just for validating why it's important. So I said it's very common, like, from random studies, 22% with severe anxiety, 60 to 80% anxiety, whatever that means, just higher than other surgeries. It's very common. And I feel like there's very few people that are just totally calm. Although I've had patients like that. But then there's a moment where something
shifts.
Some part of them, they get a little nervous for a second, even if they're like calm for the majority of the surgery. But why it's important, there's all these downstream effects. Yeah. This is where it's not meant to scare you. It's meant to say, this is why it's so important and why we're talking about it, and why you shouldn't be afraid to treat it if you need to, and why all the tools that we can give you or that you can come up with yourself to calm yourself is so important. It's not something to be ignored, basically. Yeah. Obviously, when you're anxious, your heart rate's going to be higher. Your blood pressure is going to be higher. You might have kind of like extra beats, higher risk of arrhythmias, all these things. It's just the catecholamines, everything's surging. So that's physically affecting your body. And when you're having surgery and all these things are happening, that's relevant. But then also postpartum, it reduces wound healing, increases risk of infection, increases pain. This is a big one. Also increased need for pain medication. It can have some negative effects on breastfeeding, risks of chronic pain, postpartum depression. All of these things are kind of associated with a higher anxiety state. And that's why the medical team we need to focus more on this. And it's not just the success of the surgery. This is literally the name of the podcast. The experience matters because it does have all these downstream effects. It's important and we have ways to make it better. And so we're going to talk about those. As far as medication. So obviously medication will work. Yeah.
Very quickly.
Yes, it will work, but we don't routinely do it. The medications cross the placenta. Now, just because they cross the placenta doesn't mean that they're going to harm the baby, and I'll discuss that, but they cross the placenta, so you need to consider that. And then there's a risk with some of these medications of course, sedation, memory loss. So that's important for you if you really want to be not medicated, awake and crisp and clear, then obviously it's better to not have these medications on board. Although I do believe, like I said, that when you really need it, it's not really going to do that. And there was a really interesting study. It was only 60 people, but still they gave them midazolam, which is Versed, which is like I call it IV Xanax. Right? It's like the most common preoperative anxiolytic medication that we give. They gave them midazolam and fentanyl IV as like their sedation, their anxiety protocol. I don't know why they added the fentanyl. I mean, fentanyl is a pain medication. It's not an anxiety medication. Right. But when you get light sedation for procedures that maybe you don't really need to be asleep for, but just for comfort purposes, that's the mix. The cocktail is like midazolam and fentanyl. And so they gave 2 medications. There was no difference in neonatal outcomes, no difference in APGAR scores or neurobehavioral scores of the infants, essentially just totally unchanged. And there was no difference in the mother's ability to recall the surgery.
I love that.
So that's not to say that it can't happen, but they studied it, totally randomized controlled trial. One group got saline and one group got these medications, and no one knew who got what. That's very comforting, I think.
Well, yeah, that in itself would calm a mom to know that the decision that you're making for yourself, I mean, a lot of times we want to put our babies before ourselves.
Right.
And so that is a great finding that the babies weren't affected. Yeah.
So obviously these were healthy moms. So if you're having a preterm delivery or this may not apply to every single scenario, it certainly wouldn't. We know that there are people who've gotten some of these medications and felt really out of it and they wish that they hadn't gotten it, which is why it's just like anything else. You don't get it if you don't need it.
Yeah.
And also, these were higher doses of medications that they gave them. I would start always lower. First of all, I wouldn't give the fentanyl at all, pretty much. Oh. And for the midazolam, I can start with like a quarter of the dose or at least half of what they gave and sort of see, again, because it works so quickly, if maybe you just need a whiff, just a whiff, like a quarter of what they got. And it just gives you just enough that you're feeling better.
You're back to baseline.
You're back to baseline. You're not going to forget, but you have to have a provider who's being conscious of that and isn't just giving the standard dose. Let's start low. And then if I'm not good in a couple of minutes, go higher. Obviously the woman who had the panic attack, I gave her the full dose immediately. But just something to think about.
Can I ask, what was her, like, obviously because she had experienced them outside of delivery, what did she say to you after, like, she came back down? Was she just like, okay.
It was sort of like,
but I'm sure she felt relief knowing that, like,
she was really cool. Like, she was like, see? And I was like, thank you for telling. I mean, we sort of like, I mean, I'm not trying to downplay the situation. It's not serious, but that's how our rapport was. She was like, thank you. I'm fine now.
Yes.
And she was kind of like, I told you so. And I was like, wow, you certainly did. And you were right, and people, they know. And
that's why trusting what patients say is so important, because you are the only one who knows yourself in that way. Yeah. And hers obviously was triggered very quickly, whereas other people, it's more of a build. Yes. And then all of a sudden you reach this peak that you can't control it anymore. But like sometimes you can control it up to a certain point, and then you reach that threshold where you're like, I am no longer coping.
Right. And sometimes we'll say, let's see if you can get past the spinal. Maybe it's the spinal that you're really nervous about. Yeah. And then once that goes well, then you're fine. Yeah. Or during the delivery, once the baby's out, then you're going to feel better. And you kind of see. And if you're reaching certain milestones and it's not getting better, then each time we're thinking about what can we do next. The really important thing, the idea of giving these medications is so that you can still have the surgery with the spinal or the epidural, as opposed to being asleep. Obviously, if you're asleep, then you won't be anxious. Right. You still might be anxious when you're getting put to sleep, but that does eliminate that problem in a way. And I've had patients ask me to be put to sleep because I'm too anxious. I don't want to be awake for this. I don't think I can cope. Yeah. And I've done it before and it can be done. But obviously it's not the ideal situation. If we can work something out together, depending on this certain person's risk factors for general anesthesia, if it's definitely safer for them to be with the spinal or the epidural as opposed to being put to sleep, the partner being there, everything else, all the reasons why we like to be awake for C-sections, then the risk benefit ratio is heading towards the benefit outweighing the risk, where just a little bit of medication can just change everything. And that's
we're giving them that confidence factor that you're working together with them to give them this experience in the best way possible, but staying awake for it versus being under.
Other options for anxiety medication wise. So there, some people do a little bit of Precedex, and then nitrous oxide is kind of interesting. Nitrous oxide people use for labor pain. It's basically a gas that you breathe in and you feel really, have you had it?
Yes. It just makes you kind of feel like you're in the clouds a little bit.
I don't love it, but it's so quick and it's pretty safe because it comes out, you know, so maybe during the spinal placement, if you're able to just have a little nitrous, it's quicker. I don't know that it's going to be so effective, and I definitely wouldn't be my first line recommendation, but it's a thought. Yeah. Something.
So it's a baby step down to feeling.
If you're just trying to get through some people have a lot of anxiety getting an IV.
Yeah.
Right?
Yeah.
I mean,
what also goes back to so much of like things that come up that we don't think are even going to come up. Like maybe you had one bad experience of getting an IV and you never thought about it until you're in this moment and someone's giving you an IV and all of a sudden this trigger comes forward. And that's the thing. What's so interesting in birth and in pregnancy is so many things that maybe we have suppressed through our life that we didn't even really know we were suppressing on purpose can come up out of nowhere. I mean, I experienced that, things that I wouldn't have even...
You thought wouldn't bother you or wouldn't worry you. And all of a sudden...
It was a trigger.
It's hard to cope. Totally. So I have some non-pharmacologic... things that have been proven. I love when it's proven.
Yes,
you know?
I do too.
So I can go through those, or do you have, I'm sure you have some.
Well, I wonder if we're going to talk about the same thing. I'll put what I have in a toolbox that I think is a really good helping to cope with management. And this is actually kind of like a newer practice, but it's funny, on a lot of forums and especially on Reddit, this was talked about a lot, and it's called the 3-3-3 rule. Do you know what this rule is, Jen?
I know a different 3-3-3 rule. It has to do with Pitocin administration. I don't think this is the same one.
I'm going through the holistic 3-3-3. You can take on the anesthesia one. So it's a grounding technique and it's super simple. And I think anything in anxiety, if something is too complicated, you're not going to utilize it. Yeah. So simplicity is super important. And basically what this rule is the first part of the 3 is notice 3 things you can see around you. Right. So we're instantly redirecting and regaining control. I'm going to give an example. You're in the OR and you're starting to feel yourself become a little anxious. You can look at your anesthesiologist. Hopefully it's Jen.
Hi.
You can look at your partner. You can look at that baby warmer that's set up and think of the beautiful moment it's going to be when your baby is here. And so visually, you're taking yourself away from this anxiety that's building. The second is identifying 3 sounds you can hear. So maybe some people hearing the machines is anxiety triggering, but you could be listening to a conversation that the doctors are having back and forth. You could be listening to the sound of a hum, or it's just like something,
like
whatever.
Footsteps or
anything. Yeah.
So it's kind of bringing you into where you are.
So it's taking you out of your internal place and taking you into the external surroundings. And the third is move 3 parts of your body. If you just move your hands a couple times, or you obviously... Let's not talk about below the waist because you're maybe or no. But like touching your own ear, touching your nose, something that is balancing you, because what's so interesting about the brain is when there's too much information, something has to give. So what this technique is doing and why it's calming your mind, and a clinical psychologist at the Clarity Clinic said this, it's basically a way of distracting yourself from your anxiety by shifting your attention to your senses.
Right.
So it's calming the parasympathetic nervous system. And that is what anxiety is, right? It is your muscles start tensing. So you have to find a way.
And people do that kind of naturally, right?
Of course.
the nervous tick. And it's probably not the right way to say it.
Yeah, but you're like, I feel like you see it in people's shoulders, right? A lot of us hold our tension in our neck and our shoulders.
Or is there something you could like rub with your hands or something?
Rub your hands together. You could hold your partner's hands.
Yes.
You know, it's shifting this internal feeling to your external environment.
Yeah.
So that's the 3-3-3 rule.
Okay, I love it. My list here, it's all kind of obvious stuff. So obviously the first line is reassurance and verbal support. And like you as a patient, it's hard for you to kind of ask for that. I mean, you can ask for that if you know that something is going to make you feel better. Like what you have discussed before, can you walk me through, tell me when certain things are happening, like the major things are happening. So you kind of have control, and some people may want that or may not want that, but that's something you could ask for, right? Or the distraction techniques where I just try to talk to people about whatever.
You didn't even know you're following the 3-3-3 rule when you're distracting your patients, Jen, did you?
Yeah. And this was crazy because there was a whole article on this, that the presence of partners really helps. Because I guess not everywhere they even allow the partners at all. But we can extrapolate that. So they were talking about having the partner with them during the surgery. But when we talk about how the partners are usually not there during the spinal, that's something to consider if that is the piece of it that's making you very nervous. And right now, it's not something that is usually allowed, but who knows? That could change, especially if it's shown to really decrease anxiety, which is so important physiologically, even during the spinal.
Another thing you can do during the spinal, actually, I don't know if you ever do this, but when I'm feeling nervous, I put my hands together and I'll just move each, like my pointer fingers will touch, my middle fingers will touch, my ring fingers will touch, my pinkies will touch, my thumbs will touch together. And then I'll do the routine over again. So it's like you're counting in fives, basically. It's like resetting myself, like, okay, my left part of my body is connected to my right part of my body. And that's actually a really good distraction tool.
And passing the time kind
of. And you know I don't love counting and numbers and clocks, but on that one, I do think it is helpful.
Okay. Music, having music. So this was a meta-analysis from 2021 that music helps decrease anxiety during C-sections, whether or not the music was chosen by the patient or by just the team. And I think I always ask, this is usually more up to the OB because they're operating. Most of them like music, but sometimes the patient will say no to the music. But I always, in the back of my mind, I'm like, oh, I kind of wish you, like, are we sure? Because how could it make it? I think sometimes they have a hard time choosing. It's a lot of pressure. When we're like, what do you want to listen to? And you're like, oh, I don't know.
Well, even on a normal day when someone might ask me that, I'm like, I don't know what I'm feeling right now.
Or it's okay. We don't need music. But I think that was interesting that even when they didn't choose it, if we just kind of had it on and we didn't really give the option, that I think that would be helpful for a lot of people. I mean, obviously, unless you really hate the music, but that's so important that...
I mean, who doesn't like some spa music?
I
don't think I could ever be friends with you if you don't like spa music.
A lot of people choose spa music.
I would too. I mean, I think that it's so calming. I mean, in any part of your life, if you listen to some calming classical or spa music, how can that not calm
it wouldn't be my choice, but...
Of course it wouldn't, like,
all right.
Like, let's go to sleep now.
Ding, ding, ding. But so I mean... everyone should come in, I think, just have an answer to that question just in case you get asked it. Or obviously, if that's something you want and you actively want to advocate for.
Are you challenging me to make a mix, Jen?
But it's so personal. That has to be like different. But just have a genre or an artist name or something. But I think if we just had music on and we didn't even ask people that in and of itself.
Because it could be one of the external things that they go looking for to hearing something different rather than the machines beeping or the doctors talking. It would be a distraction.
And it's generally not so loud that you can't tune it out if you wanted to or tune into it if you want to. Another one is, I forgot to look it up. Something called the Benson relaxation technique. I'm going to have to look that up and tell you guys what that is. But that was better than music.
Really?
Benson relaxation technique.
God, I can't wait to learn this one.
Wait, as you breathe out, say the word one silently to yourself. For example, breathe in, then out, and say one, in and out, and repeat one.
I'm going to do it right now. I say the word one in my head or out loud?
I think out loud.
Okay. How can I breathe out and say one at the same time?
I don't know. This is a very quick Google search. Okay, so it's finding a comfortable position, closing your eyes, and focusing on a chosen word or phrase.
Okay.
So this kind of, we're mixing a mantra here while breathing deeply. So that one was very helpful. I think any of these things that we're choosing, these relaxation techniques, are going to be helpful. And then
and they're simple.
They didn't test it. So they did music or this or nothing. And this and the music were better, but the Benson relaxation technique was better than the music. But what if we had them all?
Have them all.
Like we always say, throw the kitchen sink at it.
Yes.
Right? Same with pain. That was an interesting one. And then foot reflexology.
Yeah.
They studied that before you go in for your C-section. And that was really helpful in reducing anxiety.
Actually, that makes me think, because when I was at the hospital and I was struggling and they had a nurse that knew Reiki.
Yeah.
What had that been before the actual operation? Would I have even maybe gotten to that point?
Right.
What an interesting thing to introduce if we were helping before we get to anxiety.
While you're waiting in triage.
Yes.
For your
Why
surgery
are we
to
not
start.
sending somebody in at that moment to do deep breathing exercises, to do Reiki, I don't know, play some soft music, play some spa music while you're waiting there with your partner. Actually, you know what? Let's put that on the partner. That's what you can do in the pre-op.
Learn reflexology.
Change all the diapers. Learn reflexology. Oh, these partners are going to love us, Jen.
And then auricular acupuncture. So acupuncture on the ear, which helps with pain as well. But that also randomized controlled trial found to help reduce the anxiety.
Pre or post?
Pre. This is all pre.
This is all pre. Oh my gosh. I love that.
Yeah. The idea is you're trying to go in the best possible mindset.
Right.
And then that is going to help you long term with recovery. So you kind of have to do it ahead of time. It's helping with the anxiety going in, but then also it helps during, because if you're going in starting with a more calm state, it's probably easier to stay calm throughout.
Or maybe it'll take longer to build if it is going to come, rather than hitting you out of nowhere.
Yeah. So there's tons of things that you can do. The last thing that I have on my list is education.
Why we created our podcast.
Yeah, we are your anxiety reducing. But they studied the multimedia educational sessions. This was, again, a meta-analysis. So a lot of different places would give education to women prior to their C-section and see if it helped reduce their anxiety. And shocker.
It did.
Yeah. But I didn't get any education. Did you?
No, I was very anxious for all of mine. I did my own breathing techniques, right? I had my own tools of what I was going to use to help cope. But gosh, how much that would have helped to have. And especially in the pre-op and that waiting point, I think that's really my nerves started really amping up.
But if you could have gotten education on the surgery, I have no idea what they included in these educational sessions, but it seems like it's supposed to be kind of what we're doing, educating people on what to expect.
Right. So things
specifically
are not
for C-sections.
Yeah. So things aren't just being, again, it goes like my cousin being like, that smell, I never would have thought about that.
Yeah.
It's like knowing now the triggers for women and being able to get on top of it and why we talk about it so that you can feel validated and you can feel heard if something is bothering you in the moment. You can say like, could you hand me an alcohol swab, or do you mind using that so I can distract myself from the scent now?
Just thinking about the phrase what to expect, I have a hard time with that because everyone's experience is different.
And that's true.
But if there's one thing that happens that you did expect,
right,
that you otherwise wouldn't have, that's what it's about. It's about taking away some of those unknowns and some of those surprises, I guess.
Yeah.
By having an idea for things that might happen and may experience, you may or may not, but when things do happen that you heard about before, it's way different than just having something so shocking happen to you.
Totally. And that's why in a lot of birth classes, it's such a disservice when people don't talk about a C-section, when they are common and it is a possibility. So if you don't ever talk about it in someone's birth class, you're already setting them up for being ill-prepared when you could have prepared them. Even with just, I don't know, baseline information,
Yeah. Just refer them to our podcast.
Yeah, do that. That's better.
Okay. So what else do you have for us?
Okay. So This is so funny. I actually did this when I was in elementary school. I don't know who came into our classroom to teach us this, but somebody came in. I think I must have been in like 4th grade, and we all laid on the ground, okay? And starting at our toes, we had to clench them together really hard and then count for 5 seconds to release. And we moved from our toes all the way up our body.
This.
I remember this so. Did you do it?
Yes.
What? Who came in and taught us to do this?
Getting
I don't
relaxed
know.
thinking about it.
But I have to say that is something that I think is, again, super simple, super powerful. And even just do it right now. Clench your hands together and count for 5 seconds to release. That's when we're connecting our muscles and our mind together.
And you have to kind of go from body part to body part.
Exactly.
So these shoulders.
Exactly. It's called progressive muscle relaxation. Yeah. And that is a technique that I think, honestly, that's a life technique right there.
Yeah.
So I think that's another thing to do in the pre-op. That's a good exercise to do for yourself.
Yeah.
And have your partner remind you. I think a lot of things too, we need the reminder, because when you're in the situation, the clarity isn't there. You're like in the clouds a little bit. Even when, I think that we're pretty clear-headed minded humans, but we put us in a stressful situation, and like all of a sudden things that should be so easy, or someone else is looking at you like, just do that, Jen. Why are you complicating it? But you're unable to do that. So having someone help you through the exercise like that, this is a great thing for a partner to do.
And there's probably some apps or things too that you could listen to, because I was just in thinking about that exercise, the calmness of the voice telling you kind of what to do. I'm sure that there's an app for that you could bring.
The Mindful app is a very good app.
Yeah. And just kind of listen when you maybe are in that holding area, triage area, whatever you want to call it. And you're not going in for a little bit. Just tell yourself you're going to do whatever, this 5-minute thing or however long it takes.
Yeah. Actually, I also think that the progressive muscle relaxation is a good one to do when you're starting to regain sensation, because I think for a lot of people, I know I just was like waiting to feel sensation on my toes again and on my feet, because you're like, am I gonna be able to walk again? I'm sorry, but that's not in everybody's back of their mind a little bit, that you're like, well, what if all of a sudden I'm not,
but I've heard it enough
numb
now
anymore,
that I believe it.
or I'm only that I'm not becoming unnumb, you know, like the sensation of a dead leg is still there, and that's anxiety driven a little bit. So this is also a good technique, I feel like, as you're regaining sensation, that you can clench your toes together and then do that 5-second release and then work your way back up. You're regaining self-control. And I think that's the biggest thing in anxiety, is you're the one who ultimately has to reset, redirect, regain control of the sensation. Medication can help, breathing exercises can help, but you have to be in that mindset of, I'm going to do everything I know how to do to get myself back to baseline.
Right. And you can think of it as it's going to help you with the pain as well.
For
if
sure.
you're worried about pain, if you can tackle the anxiety and the pain together, there's downstream effects to all of this. How your recovery ends up going, you getting around and walking and doing all the things you need to be doing to optimize your recovery. It's going to be so much better if you're doing all these things to kind of handle anxiety.
Yeah.
So important.
Sense of smell. I'm such a smell person. But I do think too, if you maybe didn't have a great experience, maybe in a previous surgery or somewhere along in your life. I know, like when I was younger and I went into a glass table and had to get stitches, and the smell of the hospital, it's a triggering smell for me, because it reminds me of that childhood experience. And so if you think that a scent would be comforting to you, I will say lavender all day or eucalyptus or something, or a combination of both. Having that on hand with you is a good thing.
Yeah. And of course, if you have a doula, this is extremely helpful.
Yeah. I think what's important is doulas can teach partners how to help their partner, their wife, cope as well. And that's helpful, because throughout, once you're done with that delivery, it's not like anxiety might not still creep back up on you. I think there's a lot of moments that even after delivery that I felt anxious. Am I holding the baby the right way? You question yourself. So it's easy for it to rebuild again. And if your partner has those tools to say, no, remember, let's just take 5 deep breaths together. We got this. You're okay. That's helpful.
So helpful.
I say this all the time, but It's never the huge, massive things that make the biggest difference. It's the little tiny things that make the true difference. And it really goes back to let it be simple. Don't try to overcreate what's going to help you cope. Keep it simple.
Yeah, it's so true. Like if we could add in these little massage or reflexology or just these tiny little things before you go in, and then also in recovery and also maybe when you get home, just adding in these little things can really change the course of, you know, how you're feeling, which is,
so important. What else?
So did you want to talk about childbirth anxiety in general? Or I know you had that story, but.
Wait, what story?
Oh, or you sent me like a news article or something.
Oh, that's right. Oh, okay. All right. Actually, well, I'm like, what story, Jen?
Well, not a personal story, but it was something that you read.
I thought it was going to be a personal story. Yeah. So I actually found a very interesting article, and I think that, I mean, this talks about anxiety too, but I also think it's like why people are choosing to have an elective C-section sometimes. And I read these two very interesting stories. And one was a woman had her first daughter when her husband was alive, and her husband passed. And so her second pregnancy was the IVF baby that was her husband's sperm as well. So think of going into a pregnancy like that. Like here you're creating a life with your partner who's no longer there, and how anxious she was leading up to the delivery because she had this massive trauma already that had happened in her life, and how all she wanted to do was give her daughter a sibling. And so the best way for her to handle her anxiety, and she advocated for herself, was she wanted to have a planned C-section to take anything off the table that could possibly trigger more anxiety for her. And how she felt that she really had to push for that. And she felt like people were viewing her as she was too posh to push versus here she had this massive thing that had happened in her life, and she just needed to get through this delivery and pick up all these pieces that have already, I'm sure, had shattered in a million ways back together and bringing this full circle back with having her husband being a part of this life that's continuing on. And so I just thought it was such an interesting article because I would never have even thought about something like that. And another one was like she lost her father the day before her induction. She was like, I can't physically, I'm so overwhelmed with emotion right now. I just want to choose to have a C-section so that I'm processing already so much with the loss of my father that I need to process this new life in the most medically managed way possible.
Where it takes away some, I guess, of the unknowns.
And so I just thought they were interesting articles.
At least getting through the birth.
Exactly. So talking, about like how anxiety can build during that pregnancy, and if alleviating some of that to have a more controlled delivery is an option that you want to take, you should feel that you're not being too posh to push. You shouldn't be feeling that. It's like they were doing exactly what was right for them, and they knew themselves. And that's what I thought was so interesting in the story. It's like they knew themselves. They knew that this is what they needed to get through this.
We've already done our episode on myths, but someone just the other day was like, oh, well, it's because they're afraid of the pain of childbirth. Someone said
like,
this.
Clearly you haven't had a C-section because the pain afterwards, not that great.
Yeah, but even, it's not even like comparing it. It's just, I don't think that is it. Usually that they're afraid of pain. It's almost like you don't have any understanding then for what goes into a labor and a delivery.
Right.
But it's very complicated emotional feelings and psychological things going on that makes one option feel safer.
Well, right. Because I think the point of both the stories is life doesn't stop when you're going to have a baby. You know, other things are still happening in your life. And just because you have that due date isn't like, okay, let's hold all the drama. Let's like let everything be perfect for the week leading up to my birth. That's just not life. And so,
and it's not like we don't have options for pain management for labor, by the way. Exactly. I mean, like blow epidural.
So I don't know. I just really, those two stories just struck me in such a way that the more you read and the more you learn about why people make the decisions that they make, the more that it's like, push the judgment away.
Well, it's also like none of your business.
No, well, but that they shared it. You know what? They probably opened the door for somebody else who maybe something traumatic happened right before they were going to deliver. And it was talk about just adding on layers. If that is something that you can control, why would you not?
And clearly people do need to hear these stories that there are so many complexities to life, and people have experienced so many things that lead them to choose one thing or another, because apparently people still have this perspective that it's just this generalized fear of, I don't know, like having contractions and pushing a baby out. But I think that's always a little bit, it's just always bigger than that. I don't know.
Yes.
And more, it's just so much more complicated, and it can never be narrowed down to this, I don't know, this one thing. And the anxiety is still there. It's just different. And it's different. It's a way to take some pieces of it off the table.
Yeah. And I think that's what's so interesting about anxiety too. I mean, I've experienced just like low-key anxiety where it's like, it's not disrupting my day, but it's just like, oh, why do I feel this? And I've experienced full-on hyperventilating, you know? And I think that that's the hard thing about anxiety is there are so many different variations of it. And some of it is like present in the moment. Some of it is old trauma coming up. Some of it is if we all had a crystal ball and we're just like, oh, this is how my life would play out. Maybe I wouldn't feel this little bit of anxiety around this certain aspect of my life, but that isn't life. You don't have that crystal ball.
For me, it's like the racing thoughts, and which presents as insomnia sometimes. But it's, or when you almost know that your thoughts are a little bit not extreme, but you know, extreme, I guess. You know, that you know that maybe this is
right. Like you could say it out loud to me, and I'd be like, Jen, it's not that big of a deal. But it's like that doesn't matter what I think. It's a big deal to you. Yeah, and it's validating and it's calming someone and not telling them that what they're feeling isn't real.
Yeah. And then a panic attack is like a whole nother thing. Have you ever had a panic attack?
I've never had I guess I have.
Well, you would know.
I know.
I called 911.
Okay.
I did not know I was having a panic attack.
Yeah. I had one when I was younger because I was having a migraine for the first time and I lost sensation in my extremities. And then I started seeing half of everything. And I was probably like 10. And that was a full-blown panic attack because I did not understand what was even happening.
You start hyperventilating and then you get numb everywhere. And my
parents did call 911 actually.
Yeah.
And my grandfather, oh my God, my dad was just the funniest man. I just remember the whole time, all he was doing was taking pictures and he had his Canon camera and he was like.
During your panic attack?
Yeah, during my panic attack. Talk about using that 333 rule. I should have been seeing 3 things that were going on. And actually, thinking back as I'm saying it right now, it was distracting me. I'm like, why is Grandpa taking a picture of the ambulance? Yeah. Why is Grandpa taking a picture of me being so upset right now? Yeah. But you know what? It distracted me.
My story is I was in med school and I had like just learned about panic attack. I mean, because I don't, you know, like the physiology behind it and exactly what happens in your body. And I had an ambulance come and the EMTs were looking at me. I was like, I don't know. I can't breathe. Am I having an asthma attack or I didn't know. Yeah. And they were like, no, you're having a panic attack. And I was like, oh.
Like I just learned about this last week.
And it's helpful when you know what's happening to you because then you have a chance of bringing yourself down.
Totally.
Because when you don't know, then of course, you know, then it's going to go.
Oh, you spiral.
It's going to keep going and going. Yeah. But it's like one of those things I can laugh about now. It was like not funny at the time.
Well, yeah.
But yeah, as soon as I realized, I was like, I had slept in forever. I was working so hard. Yeah.
Well, then once you like figured out what was going on, then you could start utilizing ways to fix it.
Right. Yeah. It was just a wild experience. I'll never forget it. And thankfully, knock on wood.
You haven't experienced another one. Yeah.
But
I feel like in parenthood, all we do is have low-key anxiety at all times. I know I do.
It's part of it,
look both ways.
Because you have to worry about other humans for the first time. Think about it. You're not really chronically at all times worried about anyone but yourself. Now, like, you have to add it.
You always are thinking. Forever. Actually, on vacation, I was doing a lot of solo parenting, and the kids wanted to jump into I took them to this beach. It's like one of the most beautiful beaches in the world, but a swell had come in. So there were these like massive waves. And of course, they wanted to play in these waves. And actually, really the irony of it was at Cinnamon Bay, which was where Matt and I went to camp after we had lost Campbell. And so I'm like looking out at this view that I had looked at before and felt a lot of different feelings. And literally like, oh, like a Baywatch moment. I'm like looking with my hands on my hips, like 1, 2, 3 head. Okay, 1, 2, 3 heads. And every time each wave came in, and I kept looking,
and you're like, is it over yet?
Is it over?
Please go in.
But you know what? You know what it kind of made me think about too is like, even in this beautiful moment, here I am on this beautiful beach, I'm still feeling anxious because these are my humans. These are like the people I'm on this earth to protect in life. Yeah. And so I did actually do some breathing exercises. Also normal. And you know what I will say? It's this woman walked over to me, and you're like, sometimes when you're going through something, you're like, I wish someone would just like acknowledge, you know? Yeah. And she walked over, she's like, I just want to let you know this has to be really stressful for you. And I was like, it is, you know? But it was so nice for someone. It goes back to like how you speak to someone when they're having an anxiety attack. When somebody else recognizes it, it's just that feeling to be like, yes, I am anxious right now watching my 3 humans in these waves. It actually made me think, I was like, you know what, the next time I see someone maybe a little out of sorts, I'm gonna say a little something. I'm gonna acknowledge it. Yeah. Because it did make me feel so much better. Right away, I felt like less anxious.
Validation.
Mm-hmm. Always. All right. Are we ready to wrap it up? Do you have anything else? Any more statistics? So. Well, you know how earlier I said if we just had a crystal ball. Yeah. So I was in my son's room cleaning up, and I found this, and I was like, oh my God, I remember this from my childhood so much. A magic 8-ball. Yeah. I mean, how fantastic are these? So this is become our new thing in the morning. I'll be like, is Sether going to have a tantrum today? What is it going to say?
Likely.
Oh, my sources say no. Oh, great. But we do this in the kitchen, and then we literally all die laughing. But of course, whatever it says, if you want it to be that, you're like, yeah, it does say that. So you're going to do it. Okay. Say something to the magic 8-ball. Oh my Not gosh. Too much. But you have to
ask it a question or what?
Yeah.
Oh gosh, what if it's bad?
Well, Jen, that's the point of it. Okay. Then we'll laugh about it. We're not going to give you anxiety. Well, let's not ask something too serious.
Should it be about the podcast or something?
Yeah, how about the podcast?
Okay. Do you have an idea?
I do have an idea.
Okay, say it.
I know, but then it's not me doing it.
I'll look.
Okay, all right. Okay. Will we hit 10,000 downloads this week? Turn it over, Jen.
Reply, Hazy, try again.
Okay, let's ask again. You ask it now.
This week?
Okay, let's say.
No, let's say this week. Okay. Because then if it's not, no, I won't be mad.
Okay.
Well, we hit 10,000 downloads this week.
Fingers crossed.
Wait, how does this thing work? Uh-oh.
Gotta position it right. Hold it flat, like down.
Yes, definitely. Hooray. Let's see if it's right.
Yes. Oh, this magic 8-ball. There's a lot of fun to be had with one. Okay. Let me just tell you. If you're looking for a gift for somebody, please give them that.
I'm 100% getting one.
Yeah. Don't worry, I'll get you one, Jen.
Okay. Thanks for listening. Please reach out to us and give us some more ideas for future topics. Yes. Download our free C-section guide, csxpodcast.com/guide.
Get your hospital socks, your recovery socks.
Yeah. Message us on Instagram, the CSX Podcast. Yeah.
Yeah. Okay.
Bye. Bye.